Hello and welcome to Cutting Edge Pain Relief. When today we talk about the best patient app, period, hands down. And today we're going to have a guest joining us, Katie Wilcox from Doctorplan. And she didn't state it was the best patient app. I am. And the things that it can be able to do, what it can be able to provide, and how it can be able to help pain patients in particular really be able to get their life back, be able to punch pain in the face, and get back to leading the life that you deserve. Katie has been phenomenal in helping our practice find ways in being able to connect with patients, find ways that we can be able to improve our overall delivery of good care. And we are just enthused to have her here with us today. Katie, thank you so much for joining with us.
Yeah, thank you so much for having me.
So we're going to talk about this app, Doctorplan, and really you're going to give us a little bit of a presentation, giving us some insight about what it can do, how it does some of the things that really patients can find value with, and then maybe we can take some questions here and there if they pop up. Does that sound fair?
That sounds awesome. Yeah, I'm looking forward to it.
Okay, perfect. So let's see if maybe we can share your screen and show some of the slides I think you might have. And I will let you take it away, and then we'll kind of jump in and deal with some questions here and there. All right?
Awesome. Fantastic. Can you guys see my screen, Dr. Landrum? Can you see it there?
Yep, we can see your screen perfectly.
Okay, fantastic. So I'm so excited to be here, and thank you, Dr. Landrum and team, for letting me share a little bit more about Doctorplan. Why I'm most excited is because we work with practices like Dr. Landrum's, and it's beautiful to see how technology, using digital health technology, can really help improve the patient experience and clinical outcomes. So I want to talk about that today. What I'm going to touch on, and then like Dr. Landrum said, I think we leave towards the end room for questions, is I want to provide an overview of Doctorplan. That's the company I work for, and how Dr. Landrum and his team are using it to build a stronger relationship with his patients. I also want to share some specific examples of how patients are using Doctorplan today, and how Dr. Landrum's team is using Doctorplan to manage patients' health in those in-between moments, right? So when a patient walks out the door and they go home, Dr. Landrum and his team have a pulse on what's going on with that patient because of Doctorplan. And I want to talk through how that happens. And then lastly, I want to discuss the importance of patient-reported outcomes. And what that is when you have a procedure, an appointment, how the patient is talking about their outcomes, how they're doing after a procedure. I want to talk about those patient-reported outcomes and how using Doctorplan helps results in better care and outcomes. So here, I'm going to get you guys to think about your last doctor visit, all right? So most of us, when we go in for an appointment, right, we're kind of going off of memory, unless you're a note taker, which I am. However, when I go to the doctors, I typically don't have my notes from like how I've been feeling or the pain I've been experiencing. And it's really hard at that point when you're sitting in front of the doctor to go off of memory and try to recall how long maybe the pain's been lasting or when it hurts the most. Or I know I've been asked on a scale of 1 to 10, how bad is it when, let's say, you're walking uphill and your knee's hurting? It's really hard to recall some of those details as the physician's asking you. I remember back in my soccer days, I had a pretty bad knee injury and the doctor going through questions. And I just remember saying stuff like, I think it happened 2 weeks ago and it was at its worst. It's at its worst when I'm walking uphill or maybe when I'm walking on concrete. And it's really going off of memory. So what we did is we partnered with Dr. Landrum's team. And what we're doing is we're trying to make that conversation a lot easier for you. So you don't have to go off of memory. All right. So what we did is we created what we like to call a digital health journal. And it's helping Dr. Landrum and his team understand, like I said earlier, what's happening with you in those in-between moments so he can manage your care in between visits. All right, so Doctorplan will guide you not only, it will guide you through your entire care journey. So this is the very first, let's say you pick up the phone and you make your very first appointment with Dr. Landrum's practice. That is when Doctorplan kicks in, and it will follow you through your entire care journey, even up to 2 years post-procedure with Dr. Landrum's practice, which is pretty phenomenal. So every patient, their Doctorplan app is specifically configured for their condition and their care plan. So if you're having, let's say, lower back pain, you're going to get questionnaires specific to the lower back that we're sending you through Doctorplan on behalf of Dr. Landrum. And you're not going to receive things around knee issues if you're not experiencing that. So it's very, very tailored and specific to your condition. So what is Doctorplan? The best way to think of Doctorplan, okay, is think of it as your digital health journal. So Dr. Landrum and his team are using Doctorplan, like I said, to help manage your health between doctor visits. The data that you as a patient are entering into Doctorplan not only helps Dr. Landrum diagnose exactly what is going on with you, but will also help guide him in creating a personalized care plan for you. So Doctorplan was designed first and foremost with the patient, with you in mind. We want it to be easy to use. It's user-friendly. You'll notice even as we go through some of the next slides, I have screenshots of what the app looks like. The app, it changes from sliding scales to large boxes, whereas if you're filling out like a paper intake form, which most practices still use, you go through like 60 questions. And by the time you're going through like page 2, you're probably skipping questions just because it's the same type of question and format. Here, we're keeping it very engaging, very interesting the whole time. And again, the goal is to make your life easier. And the beauty of this is you can do all of this from the comfort of your own home, okay? Some of the things that you can do within Doctorplan. So typically when you go in for a doctor visit, you're filling out, you're getting like maybe a clipboard with some paper forms and you're filling that out. You no longer have to do that. So now all the intake forms, maybe it's health history, your medical history, all of that is sent to you before you even walk into the practice or see Dr. Landrum, and that is being filled out on the app or in the app. You can also document symptoms. So like I was mentioning earlier, if it's hard to remember, hey, I've been experiencing, knee pain and it's persisted for the last maybe 3 months. Now you can document it anytime you're experiencing that knee pain. And it's awesome because what will happen, it will date and timestamp it. And so then next time you go in to see Dr. Landrum, he's going to get a very clear understanding of exactly when you're having these issues. And he'll be able to start seeing patterns of your pain. And then he can drill it right into your diagnosis a lot sooner. Another thing that you can do is you can access post-op instructions as well as educational materials around the specific procedure or condition, as well as you can document vitals. So you can document your weight, even things like mood or sleep, all directly through the app. And then lastly, you can log all of your medications. So here, you guys, I just have some screenshots for you. This is...
Hey, Katie, quick question for you. Sorry to interrupt.
No.
It sounds like logging a lot of this information is not really that difficult to do. You don't have to be a fancy computer person, as some of my patients would say, in order to be able to enter this information. Is that right?
That's correct. Yeah. And you also have the ability, if you're not even you don't want to download an app type person, we've made it easy where we've set this up through email. So you can actually we'll prompt you to tell us how you're doing, or we'll prompt you to tell us what medications you're taking. And you can actually just answer majority of this just right through your email as well. Any other questions, Dr. Landrum?
Nope. I think we're good right now. Sorry to interrupt. Continue.
No, I love it. I love it. So like I said, here's some screenshots of what it actually looks like from the patient's perspective. On the left-hand side, this is a questionnaire. So as you, like I said, it's going to be specific to your condition. So as we understand where your pain is, so for this particular instance, it's a lower back lumbar pain that this person's experiencing. So they're getting specific questionnaires around that. And you would just go in. So here's the image of a body, and you can just simply tap on where you're experiencing the pain and then hit next question. And like I said, the questions are changing from being able to tap on a body part to sliding scales. So it makes it really interesting and engaging as you're filling it out. And no questionnaire is more than 15 questions. So you should, when you're filling this out, it shouldn't take longer than 10 minutes. And like I said earlier, the beauty of this is instead of, I don't know about you, but when I go into a doctor's office, sometimes I get a little nervous and it can be a little stressful of a situation. So the beauty of this is you're filling this out in the comfort of your own home, and you can take time with it. You could even go through a questionnaire and then stop, pause, maybe ask a family member, hey, do we have a history of X, Y, and Z, and then go back and complete it. So the information that Dr. Landrum and his team is receiving is really up-to-date, accurate information. So here you'll notice what we have is the Learn section. So what's really cool about this is we have an entire library of different articles based on different conditions and procedures. And Dr. Landrum's Doctorplan article, let's say library, is filled with all procedures specific to the types of patients that he's seeing. You will get prompted to read or take a look at articles that are specific to your condition. So like I said earlier, if you're having lower back pain, we're not going to send you or email you an article that's around, having ankle issues. It's going to be very specific and tailored to you. And then on the right side, you'll notice the activities. So we have hundreds of mindfulness exercises, that's like breathing exercises, as well as just stretching or movement exercises loaded in Doctorplan that you guys can check out as well, which is really cool. Any questions up to this point?
So it looks like everyone's following along pretty darn well. I don't think there's anything that's prompted. I guess if I was kind of jumping in and sort of pushing the envelope a little bit on the various different exercises that you have there, is there a way to track what one has done in terms of exercises for us to kind of know, like, oh, we did 5 on Monday and then we kind of sort of relaxed for a little bit, maybe did 3 on Thursday?
Yeah. That's a great question. Yeah, there's definitely a way to see what you've done. And Dr. Landrum, you have access to that as well. So at the very end of this, I'll show you what that looks like. I'll show the patients what that looks like so they can see, based on all of what's being put in here, how it's so beneficial to you and your team.
Perfect. There's also another question that was posed so astutely from the way that she did it, which is much better than how I would have done it. And what she posed is the following: how about several areas of pain? Can it be able to cover and track multiple different contexts as opposed to just one?
Absolutely. Yeah, that's a great question. Most patients are coming in for multiple different pain areas, or it started somewhere and now it's migrated somewhere else. So yes, absolutely. It definitely can cover multiple areas of the body or pain points. That's a great question.
All right, I think we're good to go right now. What else you got?
Cool. All right, so here's what I was talking about earlier, and I think this is one of the coolest parts, is being able to log your symptoms as they're happening. Because again, if I go back to my example of me being at a doctor's office and being asked questions, I know, like I said earlier, I'm going off of memory typically. And so here on the left-hand side, you'll see how easy it is to log a symptom. So that kind of back image, all you would do is tap on the pain or that you're experiencing. And then it's going to ask you, the app's going to prompt you through a series of a couple questions, as if Dr. Landrum, these are the exact questions that Dr. Landrum or any other doctor would want to gather if you were telling them in person. And we're just doing it up front. So like I said, Dr. Landrum will get a synopsis of this. So next time you come in for your appointment, he has a really clear idea and very concrete data of when this was happening and for how long. And it's also cool. So you'll notice it dates and timestamps it, right? So if I'm saying I have back pain 5 days in a row, then Dr. Landrum can look at this and be like, okay, this is real intense. The intensity is 9 out of 10. It hurts every time she is doing X, Y, and Z activities. Then when you guys meet, that conversation can be so much more focused as you guys sit together for that next appointment. And then on the right-hand side, you'll notice everything, all the vitals that you can track within the app. So you can track, like I was saying, blood pressure, weight, and then you can also do things like sleep and mood, as well as we do have the bowel movement tracker as well. So you can do a whole lot of tracking within Doctorplan, and we're going to prompt you, right? So like I said, everything's very specific to your condition and your treatment plan. So if something's not relevant, it's not going to ask you to track that within Doctorplan or log it.
Question.
Yep.
So is there a possibility in the future, if not now, to be able to have some of that data input via wearable? So if someone has like a Fitbit or a Garmin or something of the sort, so it may be a little bit less manually time intensive?
Absolutely. So we are in the process of having it sync with the different wearable devices. So that's definitely in the works, and hopefully will be out soon. That's a great question.
Okay, keep going.
Cool. All right, you guys. So this is a type of questionnaire that you'll see within the Doctorplan app. So we're calling it a patient outcomes questionnaire. So this is questionnaires that are either pre or post procedure that are going to help Dr. Landrum understand how to really how you're progressing throughout your treatment with him. So for example, let's say we give you a questionnaire pre-surgery, okay, and we understand, okay, the level of pain for this patient is at X, and then we send the same questionnaire 2 weeks after surgery, and your pain is at another level, and then we follow up with you 3 months. So we're able to really track your progress over time and understand the outcome of the procedure or care plan that Dr. Landrum has mapped for you. As well as on the right-hand side, what you'll notice is we have embedded in it. So if Dr. Landrum does any video visits, which was huge during COVID, and still is, right? So Dr. Landrum actually, once you download the app, Dr. Landrum can actually just click and it would ring to your phone as if it's like a call, and then you can just do your video chat straight through Doctorplan with Dr. Landrum. Super easy to use. I know a lot of practices during, when everything shut down, they were kind of trying to figure out how they were going to navigate a virtual clinic or virtual consultations with their patients. And we knew we had to make ours super, super easy to use. So it's extremely easy to get on, have that conversation with Dr. Landrum, and go from there.
Hey, Katie, can I jump in for one quick second?
Yeah.
So
sure.
Less of a question and more of a comment. First of which, I think, of all the different apps that we've had association with, I think you guys are our front runner. There's no doubt about it. Not only in terms of your innovativeness, but also your ability to be able to adapt, and not so much just to us as a practice, but more so to the patient. To me, I think that element that looks at on the left-hand side of the screen, the components of patient outcome, is really what we're, at the end of the day, very much about. We want to be able to figure out how can we be able to improve that patient's quality of life. And, sometimes really when you get to the point of trying to figure things out like that, if it's not measured, then it can't necessarily be improved.
Yep.
And in this context, to be able to look at actual tools that quantify that and allow us to be able to track it. Many times I know my pain patients have felt where they have various different oscillations where it kind of goes up and down. And to know that that up and down is going in a trend that's a good thing, as opposed to it staying stable and being frustrated, and being able to look at that data is incredibly useful, not only in terms of physical outcome, but also in terms of mental health. It's kind of interesting because one of our patients, she didn't have a question, but she does have this following comment. And that is, she really loves using this app and it's super easy. And I think that that is a testament, not so much to our practice, but more so to the app itself and how impactful it has been for our patients as a whole. But I know that we're not quite wrapping up just yet. I know we have some other things to kind of add, but I do want to say that having that journal in order to be kind of in better alignment with a patient has certainly improved our practice ability to be able to be responsive, as well as patients feeling like we're more connected to them than what we otherwise had been.
Absolutely. And thank you. That's such a sweet comment. And this segues perfectly because I wanted to spend a little bit of time talking about the outcomes. So Dr. Landrum, they are using the data that each of the patients are tracking within Doctorplan to not only help create very specific care plans for each of them, because they can have a way better understanding of what's going on with that patient, but also to track, like you were just saying, the results and the outcomes over time of patients. And you could look at a particular procedure and see how that's resulting of multiple patients over time. So that data is so critical as we look at it. I talked about this a little bit earlier, but it is really important. What we're doing with Dr. Landrum's team through Doctorplan is it doesn't end. The journey does not end when the last procedure is done, right? So what we're doing is we're following up through Doctorplan, and then Dr. Landrum intervenes where needed. But when the procedure is done, we're following up 2 weeks after, 6 weeks after, a year after, even up to 2 years. So we have an understanding of, did anything kind of come up that we need to address? And so that's really, really important as we start looking at the data as a whole and why this is so important for us to be tracking. Dr. Landrum, did you want to spend any more time here? I know it's a really big piece.
Yeah, I think for us, one of the major things that we haven't taught to some of our patients, even using it right now, is in regards to the following aspect. And that is, one of the things that we're going to look to do is to take that outcome measure and hopefully, with a patient's consent, be able to put it into a registry component. So we can really be able to give an answer to a question I'm posed so many times for different procedures, which happens to be, okay, this particular procedure, for me, what's the percentage likelihood of success in regards to how this is going to come out? And I think in order to be able to answer that question, some of that is a gut feel and some of it is an experience feel. But many times what we really need to be able to do is to say, how can we be able to quantify that by looking at a number of patients and saying, okay, did they fit into this particular category of however you define the underlying problem? And then what happened once you pose that treatment? And so I think that that's a way that you can really hit, which is one of the key aims on your website. And I think really progressive therapies as a whole is personalized medicine, meaning how can we target this? So I know that we're going to talk about a few other things in that regard of personalized medicine, but we're going to take a quick break for just a second to kind of do a little bit of brand commentary, and then we'll be back in just one sec. So I'm here with Katie Wilcox from Doctorplan, and we're talking about an app that really helps patients have a voice. Not just a voice to be able to communicate with their physician, but a voice with understanding their care, being able to track it and know what their progress is like. And so right now we're talking about that context of how do we be able to really craft medicine so that it's a personalized evaluation for each individual. So they make sure that they feel like, you know what, this is the fit for me. So if you have a neck problem, you may not necessarily want to talk about your knee right now. And what are we doing to be able to drive better care to getting you back on your feet and doing the things that you really want to be able to do? And so again, we are really graced to have Katie Wilcox with us here today to be talking about Doctorplan. And I know she has a few other comments about some of the things that the app can be able to do. So I'm going to let her continue that comment.
Awesome. Thank you so much. So I only have one more slide for you guys. And this piece is, I think, really, really cool. And I wanted to share with everybody on online with us today. So this is based on everything that the patients are reporting. This is what is produced and why it's so important. This is what is produced on the physician side. So this is what Dr. Landrum and his team will be able to gather as patients input data and fill out questionnaires and log symptoms within Doctorplan. And this is called a face sheet. So what our team does is aggregates all of that information that you're inputting. And then what we do is we put it into kind of a beautiful style. We call it a face sheet. And what Dr. Landrum will use this for is he'll take time to review this. And think of it as a synopsis of everything that you've been reporting. He'll take time to review this. So when you walk in for that next visit, or maybe it's a first visit or a follow-up visit, he has an understanding of what's been going on with you. And so it's you guys aren't going to be starting from scratch. There's a starting point. So it's so critical that when you do have access to Doctorplan, you start using Doctorplan, this is what it looks like. I just thought it was important to bring this in because this is what is shown to Dr. Landrum, and this is why it's so important. And you guys can really target that conversation as you're coming in for your appointment. So I'm going to open it up for questions. If anybody has any additional questions, I would love to hear from you.
Katie, so I have a question.
Yep.
I'm sorry, what were you going to say?
Well, I was going to say, maybe I also mentioned, so let me talk a little bit about the process too, of how you would even get started with Doctorplan. So as you become a patient of Dr. Landrum's, what we do is we send you a welcome email that will come from Doctorplan, but it has Dr. Landrum's face on it, and it has Cutting Edge, the logo and everything on it. And in that email, it's going to come in an email form. All we're asking you to do is just confirm your email address, and you're set up ready to go with Doctorplan. If you choose to download the app, which there's a little bit more capability in the app, then you would just go to either iOS or Android, and you would go to the App Store and you would just download it. $0. It doesn't cost anything from the patient's perspective, but that's literally as easy as it is. It shouldn't take longer than 5 minutes. And Dr. Landrum knows this. If anybody has any questions or trouble or needs support, I'm available to take phone calls or whatever's the easiest form of communication for you, phone calls, texts, emails, and I can walk you through step by step of how to get on Doctorplan, but super easy. Dr. Landrum, I think you
Katie,
had a question.
just to come off. Yeah, I don't want to come off like it's a Saturday morning like infomercial that's like trying to sell people, but no. I want to kind of do a recap, and I know it's not for $9.99, right? So look, this is the gist. This is an app that, number one, the patient doesn't have to pay anything, which I think is really unique, because the patients are like, oh, are you charging my insurance? We're not charging your insurance. There's no deductible. There's none of that that's involved. This is just a way for us to figure out how to be able to deliver better care to you.
Right.
And we're talking about being able to recapsulate this. Number one is that it's a patient journal piece, which I think is one of the things that is, for lack of a better way of saying this, is one of the sexiest pieces about what it delivers. Because as Katie originally mentioned, it's hard for me to remember what I had for lunch yesterday. let alone try to be able to recall a specific incident that caused a problem and an issue 28 days, or maybe for some patients when they're seeing their doctor 3 months ago.
Years sometimes.
And yeah. And so that's probably one thing that I think is interesting and unique. And let me just point this out for those patients who aren't our patients, or maybe patients of other providers, is this isn't just for us. There are other practices that use this, and it's across multi-specialties. It's not just for pain management, though we feel like there's a really good fit and niche for it, but it can be used across a lot of different specialties that allows for your healthcare provider to be able to say, I'm starting to get where this patient is coming from. I'm understanding their problem that gives them an issue at night. I understand when they have a medication issue that potentially doesn't agree with them, or there's a problem that presents post-procedure. Trying to get a hold of a physician, a nurse practitioner, or other healthcare provider on a weekend or during a holiday can be pretty darn difficult. And sometimes even be able to navigate telemedicine as a separate entity can also be challenging for those people who just aren't really that tech savvy. So to imagine having all of this wrapped up in one that you don't even have to pay for, that makes a better delivery of care to you, so you can get everything, for the most part, all in one place, is a really unique offering. And that's one of the reasons why, although I know it has made Katie kind of make that face like, oh my gosh, you have said that we're the best patient app ever. I'm not so sure that we're allowed to say that. But in my opinion, my estimation, I really do feel like that's a lot of value there for you to be able to have a journal, for you to be able to have a telemedicine component that's easy. You don't have to enter anything. You don't have to remember the Zoom link. It's just all you have to do is open the app and we can call you directly. For you to be able to have HIPAA appropriate secure messaging, to be able to reach your doctor and their clinical staff. All of those things involved in one is a really unique offering.
I don't think I could have said it better. That was amazing. Thank you.
Of course. So actually, a commentary from one of our pain nurses, not in our current practice, but when I used to practice in Chicago, has the following statement, as I'm trying to pull it up.
Okay.
And I do think that that's correct. It's a really great way for being able to track outcomes. No doubt about it.
Yep. Absolutely.
And just for patients, for you to kind of say, well, why would I want to track my outcomes besides I just want to be better, right? One of the reasons why you want to track outcomes is eventually insurances are looking at, and I'm sure you probably already know, how do you have a higher deductible, and with that higher deductible, what are going to be the services that are going to be better for you in terms of getting a response? And right now, it's not always about what gets the best response. Sometimes it's about what's most cost effective. And if we can be able to demonstrate the outcomes that are in alignment with services that are cost effective, we can be able to offer many services to patients which they may not already have.
Mm-hmm. Absolutely.
So Katie, I'm going to give you a question that's going to come from a little bit from left field. And I know there's certain things that you can't necessarily say because there's competitive advantages and there's only a few things that you might be able to kind of suggest. But much how you sometimes have, drama shows or maybe even some, I guess, real life TV that sort of kind of teases, what are some of the things innovatively that you guys are looking at as next steps that you might be adding to the app?
That is a great question. We are always evolving, I feel like we were talking about earlier, as the health space evolves and changes, which it changes so quickly, especially with what we just went through and are going through still with COVID. Keep saying went through because I feel like everybody's getting their shots and things are getting somewhat back to normal, but we are constantly evolving. So there are a few things on the horizon. A lot of it does have to do with the patient outcome side of it, and being able to give further down the road. So past that 2-year marker, outcome reporting on the physician side and the practices side, so we can start looking at that data as a whole. So it's going to be more on that side of it, and we're really excited for these new things that we're working on. I didn't go into too much detail, but yeah, there's a couple of things on the horizon, and we're really excited about it.
Okay, So let me add some logistics stuff, because sometimes there are people who sit in one camp versus another camp. And specifically, I'm referring to Android versus Apple. Can you navigate both waters? Are you only specific for one? Are we out of luck if we only have Android? Or are we out of luck if we only have Apple? Can you give us some ideas about that?
So today you can use the Doctorplan app if you have an Android or iOS system. And like I said earlier, if you are, and we hear this, there's a handful of patients within practices that we work with that are just anti-downloading one more app, or they might still have a flip phone and they don't have the ability to download an app. That's totally fine. You can do things just straight through your email, and it will just come up whatever let's say it's a questionnaire that Dr. Landrum's team needs to collect from you. You'll receive that from Doctorplan in an email. You would just click the link in the email and you can fill everything out right from your desktop. So Android, iOS, and desktop capability.
So Katie, one of the things that we want to do is not just promote our practice. That's not really what we're about. Well, the reason why we have this channel is to help patients really be able to get value, understanding their options in general. So excluding pain and regenerative medicine for the time being, can you talk about other specialties where you guys have really found an entree into, and how have you been able to help these other specialties that patients might find valuable?
That's a great question. Yeah, so we work with practices, typically private practices, and all across the country, where we work most with pain, spine, neuro, ortho, but we also work a lot with oncology practices. So we're in a handful of oncology practices, and that is huge. If you think about the experience that someone's going through when they're going through chemo or radiation, a lot of these practices will do something called chemo teach. And in chemo teach, they're sitting typically in person with a staff member from that practice, a nurse or nurse navigator, and they're going through what their chemo plan is going to look like as a patient. And think about, like I was talking about earlier, thinking about filling out a form at a practice. Well, I think about the experience of somebody going through that and trying to remember everything that they're being told, and they're maybe getting a packet, and when they leave that office, they just might be super overwhelmed. They might misplace the packet. So where we come in is we follow up from a chemo teach or an appointment with your oncologist, and we send everything through Doctorplan. So all that communication or messaging is not only being done in the practice, but we're also following up with it. So it's stored and can be accessed just right from the patient's phone. And we've noticed, this is actually a really cool story to share. One of the practices that we work with, an oncology practice here, they were working with a patient who had downloaded the Doctorplan app, and this patient would come in for their appointments and just seemed always like in a great mood and everything was great, but they knew that that things were, from like a treatment perspective, things were a little bit challenging. And so through using Doctorplan, that patient felt actually more comfortable documenting in Doctorplan than someone face-to-face, that emotionally they weren't doing that great. And so it was a really positive experience when they came in for that next appointment, that the nurse navigator was able to sit with them and say, hey, I noticed that you documented this in the app. Can you tell me a little bit more? And that really helped that patient open up. And it was such a beautiful story, because that conversation, from what the practice told us, that conversation wouldn't have happened if the patient hadn't gone through the app and documented that. So that really stuck with me. And I think it's a really cool piece to what is we're trying to do through the app that again, really stuck with me, and I like to share.
Katie, I think that experience, actually, we've echoed that similar experience here in our practice, where initially a patient may be having a good experience and outcome, and some things change in the interim period before we see them. Mm-hmm. And they've been able to kind of leverage really the aspect of pros. because sometimes we'll measure things quantitatively, but you just really don't get the story until you hear it in the person's, in essence, voice. And so
Right.
that way you can be able to interpret it and intervene sooner than what we otherwise would have. And I think that that's a phenomenal piece. But to that end, one of the things I'd like for you to comment before, as we start wrapping this up, is really about HIPAA compliance.
Yep.
And not so much because we're trying to be fancy and say, okay, we're meeting all the rules and regulations, but more so the following. A patient's story is personal. And many times they really don't want to have that possibly get out. And right now, healthcare records are becoming some of the most easily attacked efforts. And I think from the inception, you guys were very focused on making sure that that patient's story stayed secure. Can you talk a little bit about that?
Yeah, that's a great question. That's a big piece of it. So we are 100% HIPAA compliant. We actually use Amazon services, HIPAA compliant whole procedure. And our founder, there's two founders, husband and wife, but the founder of the company, his last company was sold to Amazon, and his wife's an ER doctor. So they kind of merged their thought process together to form this company today. So HIPAA compliancy is top forefront for our company. And one thing to reassure, the only people that have access to the data or the story or the information that's been shared within the Doctorplan app is that practice and your physician, your care team. Nobody else has access to it. We're not selling the data to anybody. And that's a very important piece. And I'm glad you brought that up, Dr. Landrum.
Thank you. I think, one of the things that has been really an impetus that we've tried to kind of push our patients, I'm not going to say nudge, push our patients, is our patients love to communicate with us, not just via voicemail, but sometimes via email. Yeah. And email is not always the most secure. And we want to make sure that the things that are important to you are protected. And it's one of the reasons why we push for the utilization of this, because it helps not only compile all the data, it also helps it be secure. So that way we know we can make sure patients are feeling like they can be able to express everything that they want to without feeling limited, like, would I be concerned if this went somewhere? Well, this isn't going somewhere because of what you guys have done in order to safeguard and protect it.
Right. Very valid and great question. I appreciate you bringing it up.
Okay, so last question.
Yep.
Not one that's going to be too tough. Is there anything else that you'd like to add that maybe I missed about what you guys do and what you're looking to do going forward?
I think I'll end with this. I think the best way to think about this is what we're trying to do. If we add features to the app or capability, it will look a little bit different, but the end goal is to really, the thesis of the company is health happens in between visits. I want to leave you guys with that. So today, up until we started thinking of Doctorplan and implementing it at practices, it wasn't until a patient raised their hand or called a practice or, said, hey, something's going on with me, or I have an issue. We're trying to solve for that. And so I think it's really important work of what our team is doing and practices like Dr. Landrum's who want to partner with us to say, let's understand what and listen to a patient and help understand what's happening in those in-between moments. And so I just want to leave you guys with that. That's the entire thesis of the company. And we, I hope to personally get to work with you one day. And I appreciate you letting me join today. This has been super fun.
Katie, again, thank you for your time. We are graced to have had you here to be able to kind of have a discussion about how we can be able to improve patients' lives and in our case, be able to help them be able to get over their pain, how to punch pain in the face and get back to leading the life that they deserve. Thank you to everyone for joining us. We look forward to seeing you again in the near future.